So I'm going to go ahead and check the patient's record before I go into the patient's room. Um, so I'm checking the patient's medical record. I'm going to knock before I go in. So I'm knocking, and when I go in, I'm going to hand sanitize my hands, and I'm going to introduce myself to my patient. Hi, my name is Terry Fuentes. I'm a student nurse, and I'm going to need to verify your name and date of birth, please. So I'm checking the patient's ID and checking for his name and date of birth, and he verified it. And I'm also checking for allergies to make sure my patient doesn't have any allergies. And then I'm going to just let my patient know that we're going to be doing a peripheral IV today. And so we're going to go ahead and get all my supplies set up for that. Oh, I'm going to put my gloves on first. Putting on my gloves. And I did hand sanitize my surface, and then I'm going to put a check underneath the patient's arm, and then I'm going to start prepping everything, getting everything ready. So I'm setting all my tape out, getting my gauze ready and my alcohol ready, getting my tourniquet ready also. I'll need this to check for the patient's veins. I'm going to get my tape ready also. So I'm going to place my tape here so that it's easy for me to grab and it's on a clean surface. And I'm going to get my extension set primed and ready. And getting my saline. So I'm going to check for any air bubbles that are there, and I'm going to get the air out. So I just retracted a little bit, and then I'm just going to go forward real slowly until I don't have any bubbles. Okay. And then I'm going to flush my line, or not flush it, I'm going to prime it. And then I'm going to loosen my cap a little bit so that I can flush or prime it. Make sure there's no air bubbles there. And I did loosen my cap a little bit so that it's ready. And then the last thing I'm going to do while I'm getting ready is I'm just going to loosen the cap on my needle here. So my cap is loosened on my needle. So the next thing I'm going to do is I'm going to apply my tourniquet. I don't want to leave my tourniquet on longer than 2 minutes, but I am going to put it on now because I do need to check for my patient's veins. So I'm checking for my site. And I don't know if I said this or not, but I'm going to avoid, I think I did say that. Yeah. believe I found my site, my location. So I'm going to release my tourniquet and I'm going to change gloves. And I'm going to put on clean gloves and I'm going to clean my site. So when I'm cleaning my site, I'm going to go up and down, and then I'm going to make a circular motion from the inside moving out, and I'm cleaning this for 30 seconds, and then I let it dry for 30 seconds as well. But because this is a mannequin and for the purpose of getting this done, I'm going to go ahead and dry it with my gauze, but in reality we would not be drying this off. Alright, and I'm standing up. So then I'm going to go ahead and put my tourniquet back on. My tourniquet should be about 3 to 4 inches above my thigh. And then before I go in, I'm going to make sure that my bevel is up. And then I'm going to secure my site and go in. It might feel, I'm going to let my patient know, you might feel a little poke. And I do have a flash of blood, so I'm going to advance my catheter. At the same time, I'm doing my safety, pulling back on my safety. And then I'm switching my hands, and I'm going to occlude the vein, take my tourniquet off, and I'm discarding my needle. And then I'm gonna, my tape is stuck. I'm gonna apply my flush. And then I'm just gonna check for blood. And my.
It does. It does.
Okay. And I do have blood return. So I'm going to flush 3 to 5 mLs. And I'm just making sure that we're doing this just to make sure there's no, that it's not infiltrated. Okay. So then I'm going to clamp this off. And then I'm going to tape my site just to secure my needle.
He went forward with the no ball. Remember, you gotta have the ball in your hand in order for the he went forward without the ball in his hand, and the ball hit his shoulder. That's what popped the ball up.
Just use a second piece of tape because it's not staying on.
My dog Hugo. Try mine.
So I secured my needle, and then the next thing I'm going to do is I'm going to tape, I'm going to do a J-tape for my line, and I just disconnected the flush, and I'm applying my tape. And then I'm going to apply also my Tegaderm dressing. So I'm taking my tabs off for my Tegaderm. And it's a little sticky. Okay. Alright, so my Tegaderm is on. My IV line is set. So I'm going to give my patient a call light, let them know to call me if there's any discomfort or pain, if they need anything, and then I'll be back in a little bit. Before I do that though, I will put on my label, and my label is going to have my date and my initials on it. And then I will come back and discontinue this IV when the doctor states it's time to discontinue it. Okay, so I've left the room. I'm coming back in. The doctor has stated that it's time to disconnect the IV. So I'm going to go ahead and put on fresh gloves. I'm going to hand sanitize in, put on fresh gloves, and then I'm going to go ahead and disconnect this. So first I'm going to take my tapes off. So I'm just pulling at it, at the Tegaderm. I'm just pulling down and the Tegaderm just comes right off whenever I pull. At the same time, I'm also securing my needle, my catheter. So it comes right off. And then I'm gonna put my gauze here, withdraw my catheter, and I'm gonna ask the patient to place their fingers there and put pressure. Gonna throw this in the sharps, and then I'm gonna place a piece of tape over my patient's gauzed site after they had put pressure on it. And then make sure the patient's okay, make sure they have their call light in place if they need anything, and then I'm gonna go back and document all of my procedures. Thanks.